The cold came down from the Cascades like something with a grudge. Maren Sollis had learned to read the mountains the way some people read faces. The way the cloud line dropped told her whether the pass would close by nightfall, whether the snow would be wet or dry, whether anyone was going to make it up Forest Service Road 47 without chains. Most days, she didn't care either way. Most days, she preferred the road stayed shut. The cabin had been her father's first. Then it had been his and hers summers and winters, and the brief, strange in-betweens. Then it had been just hers, and she had locked the gate at the bottom of the access road and not opened it since the funeral. That was 14 months ago. Kodiak sat at the window, now, watching the tree line the way he always watched it. Still as stone, ears forward, the ridge of his spine just barely raised. He was a Belgian Malinois, black and tan, with a scar that ran along his left jaw from a training incident she never talked about. The scar had healed badly. His trust had healed worse. He didn't growl at the tree line. He just watched. That was how Maren knew he'd heard something she hadn't yet. She set down the cup she'd been holding, coffee gone cold for the third time that morning, and crossed the room without a word. She didn't call his name. She didn't tell him to relax. With Kodiak, that kind of reassurance only made things worse. He needed to know she took it seriously. So she went to the window and stood beside him and looked where he was looking. Nothing moved in the trees. She waited. Kodiak's ears didn't come down. "Okay," she said quietly, to herself as much as to him. "Okay." She went to the kitchen and swallowed 2 ibuprofen with what was left of the cold coffee, because her left side had been aching since Tuesday and she'd been ignoring it the same way she ignored most things that required her to admit something was wrong. The ache had started as a low-grade pulse just below her ribs. By Thursday, it had become something with teeth. By Friday morning, this morning, it had woken her up at 4 a.m., and she had lain in the dark for an hour telling herself it was a pulled muscle, a bad night's sleep. Too much time splitting wood. And she had done 2 tours with the Marine Corps' K9 unit in Helmand Province, and she had run a military working dog program for 18 months after that. And she knew the difference between something important, a body. She just wasn't ready to listen. She just wasn't ready to. Kodiak turned from the window and looked at her. His eyes were amber and very steady, and they had a quality she had never been able to describe to anyone who hadn't worked with a high-drive Malinois, a kind of attention that felt less like an animal watching you and more like being read. "Stop it," she told him. He kept looking. The pain moved then, a bright hard roll from her left side, straight across to the center of her abdomen, and she gripped the edge of the counter and breathed through it and did not make a sound. She had learned not to make sound when things hurt. It was the first thing the Corps had taken from her, and probably the most useful thing it had ever taken. And she was only now at 29 and alone in a mountain cabin in October, beginning to understand what it had cost her. The pain faded back to a pulse. She straightened. Her knuckles were white on the countertop. Outside, the cloud line had dropped another 100 feet. She lasted until noon, not because the pain got better. It didn't, but because she spent the morning convincing herself it would. She stacked wood she didn't need to stack. She cleaned the rifle she'd cleaned 2 days ago. She sat with Kodiak on the porch in the cold air and ran her hands through his coat and felt his ribs and his spine and the solid warmth of him and told herself she was fine. At 12:17, she stood up from the porch steps, took 3 steps toward the door, and the pain hit her so hard her vision went white. She caught the porch railing. Her knees didn't go, which she was grateful for. The railing held, which she was also grateful for. Kodiak was on his feet in an instant, pressed against her left leg, not pushing, just there, the way he'd been trained, the way that was now simply him. She breathed, she counted. The white behind her eyes faded. "All right," she said. The word came out thinner than she wanted. She looked at the sky, she looked at the road. She thought about how long it had been since she'd driven down the mountain, and how much she did not want to do it, and then she thought about what her father had said to her once when she was 17 and had broken 2 fingers in a climbing fall, and spent 4 hours convincing herself she didn't need a doctor. "You can be tough or you can be smart," he'd said, "but you can't be both when you're already injured. Pick the one that keeps you alive." "Fine," she said, to no one, to him, to whatever version of him still lived in the spaces between the trees. "Fine." She went inside and put on her jacket. She clipped Kodiak's lead, not the working lead, the regular one, which he tolerated the way he tolerated most things he considered beneath him, and she took her keys and her wallet and her phone, which had 2 bars of signal and 14% battery, and she walked to the truck. The drive down Forest Service Road 47 took 22 minutes in good conditions. The road was rutted from last week's rain, and one of the switchbacks had gravel wash across it that she had to navigate slow, and by the time she reached the highway her hands were shaking on the wheel, and she wasn't entirely sure if it was the road or the pain. Kodiak rode in the back seat. He sat upright the whole drive, watching the road the way he watched the tree line. Not anxious, just monitoring. The lead was clipped to the grab handle above the window. If anyone had seen them on the highway, they would have seen a woman with close-cut dark hair, and a grey face driving a muddy truck, and a dog in the back seat that looked like he was in charge. She made it to the valley floor. She made it through 2 traffic lights. When the 3rd light turned red and she stopped, she put her forehead down against the steering wheel and breathed and waited for the pain to cycle back down and thought, with a clarity that surprised her, "I should have left 2 hours ago." Garnet Falls Regional Medical Center was not a large hospital. It served 3 mountain counties and a stretch of high desert that most people drove through without stopping. And it had an ER that ran on a skeleton crew on weekdays, a Level 3 trauma designation, and a reputation, among the locals anyway, for competence without pretension. Maren pulled into the ER bay and sat in the truck for a moment, collecting herself the way she collected herself before anything that required her to be around people she didn't know. Kodiak watched her from the back seat. "You stay," she said. Then she looked at the parking lot, the sky, the sliding glass doors of the ER entrance. She thought about leaving him in the truck. She thought about the cloud line and the temperature and the fact that she didn't know how long she'd be inside or whether she'd be able to come back for him if things went sideways. She opened the back door. "Come on!" The automatic doors of the ER opened to fluorescent light and the smell of antiseptic and the sound of a monitor beeping somewhere she couldn't see. 2 people were in the waiting area, an older man with his arm wrapped in a dish towel, a teenage girl with an ice pack on her ankle. Both of them looked at Maren when she walked in, then both of them looked at Kodiak. The registration desk was staffed by a man in blue scrubs who had the practiced calm of someone who'd worked intake long enough that almost nothing surprised him anymore. He looked up, he looked at Kodiak, he looked back at Maren. "He's a service animal," Maren said, before he could say anything. "Psychiatric service animal. Working designation. He goes where I go." This was partially true. Kodiak had been certified as a service animal when Maren had transitioned out of the Corps, a process that had involved a lot of paperwork and a therapist she'd seen exactly 4 times before deciding she was done. The certification was real. Whether she used him the way the certification described was a more complicated one she didn't examine closely. The man at the desk, his badge said Theo, registration, nodded once. "All right, what brings you in?" "Pain. Left side going on 5 days. Bad this morning." She paused. "Bad enough that I drove down a mountain." Theo looked at her face. Whatever he saw there made him reach for a form with a little more speed than usual. "On a scale of 1 to 10, 7, she said. Then, because she'd been honest with herself in the truck, and she might as well continue, 8. They took her back within the hour. A nurse named Adeline Marsh took her blood pressure and temperature and asked the intake questions in a quick, efficient way that Maren appreciated. No small talk, no overly careful tone, just information gathering. She was maybe mid-40s, brown hair going grey at the temples, and she had the quality that the best medical staff shared with the best military personnel. She made you feel like she'd seen worse and handled it, and would handle this too. Kodiak sat beside the exam table. He did not look at Adeline Marsh. He looked at the door. "He won't bite," Maren said. "As long as no one moves fast toward me." Adeline paused in the middle of taking notes. She looked at Kodiak, she looked at Maren. Understood. "I'll let the team know. Thank you. How long since you've had anything to eat or drink? Coffee this morning, I couldn't eat. Water? Some." Adeline made a note. "When did the pain start?" "Tuesday. I thought I'd pulled something. Any fever?" Maren thought about the 4 a.m. waking, the way her shirt had been damp. "Possibly. I didn't take my temp." Adeline looked at her with an expression that was not judgment exactly, but something adjacent to it, the look of someone calculating the distance between what a patient said and what a patient had actually experienced. "How far did you drive to get here?" "About 40 minutes. Alone?" "Yes." Adeline wrote something. Maren didn't ask what. The doctor who came in was young. Younger than Maren expected, or maybe just younger looking, with dark eyes behind wire-rimmed glasses and a kind of focused energy that she associated with people who had recently finished something difficult and were still running on the momentum. His name, according to his badge, was Dr. Evan Crow, and he introduced himself with a brief handshake, and then turned his attention immediately to the chart, which Maren found reassuring. He was good with Kodiak, which she also noted. He didn't reach for the dog. He didn't make the mistake some people made of trying to establish friendly contact when the dog clearly wasn't interested in friendly contact. He simply moved around the room with an awareness of where Kodiak was positioned, the way a competent person moved through any space containing a potential variable. She liked him immediately. "We're going to run some blood work and get you into imaging," Dr. Crow said, reviewing the intake notes. "Based on what you're describing, the location and the duration, I want to rule out a few things." He looked up. "Has anyone in your family had issues with their kidneys?" "Gallbladder. My mother had gallstones." "Years ago," he nodded. "Okay." He moved to examine her, and she sat still and let him, which was not nothing. Letting people near her required active management of something that lived in her chest and had no clean name. She breathed through it. When he pressed on her left side and she couldn't stop the sharp exhale, he made a small sound of acknowledgement that was neither dramatic nor dismissive. "Okay," he said again. "We'll get you into CT. Adeline's going to get you set up with an IV and something for the pain in the meantime." Maren looked at him. "What are you thinking?" He met her eyes. He didn't hedge. She appreciated that. "I'm thinking it could be a few things. Some of them straightforward and some of them not. I'd rather have the imaging before, I guess." He paused. "But I don't want you to be in pain while we wait." "I'm fine." Dr. Crow looked at her with an expression very similar to the one Adeline had used. "You drove 40 minutes alone while presenting at least an 8 on the pain scale," he said. "You don't have to keep convincing me. You're tough. I believe you. You can also have the pain medication." She looked at him for a moment. Then she looked at Kodiak, who had turned from the door and was watching her with his amber eyes. "Okay," she said. "Fine." The CT results came back at 3:17 in the afternoon. Dr. Crow came in carrying the kind of expression that medical professionals wear when they have information that is serious but manageable, careful, composed, with something behind it that was neither false reassurance nor unchecked alarm. Adeline was behind him. "So," he said. He pulled the chair from the corner of the room and sat down, which she recognized as a technique. You sit down when you're about to deliver news that needs to be heard sitting down. "You have acute cholecystitis. Your gallbladder is significantly inflamed, and there are stones. The good news is it's contained. The bad news is you've been walking around with this for what is probably closer to a week than 5 days. And I want to keep you overnight, possibly longer, and talk to our surgical team about the best path forward." Maren was quiet for a moment. Outside, somewhere in the hospital, a door swung shut. "Surgery," she said. "Possibly. Likely. Honestly. But we want to get the inflammation down first and make sure you're stable." He leaned forward slightly. "You caught it." "Okay. You could have waited longer, and you didn't." "That matters." She nodded slowly. Her eyes went to Kodiak. "He can't stay in the room with you," Adeline said, gently but directly, the same efficiency she'd shown throughout. "Hospital policy. But there are options. Do you have someone who could come?" "Family. A friend?" Maren thought about this. She thought about who she would call. She thought about her mother in Phoenix, who would come immediately and be unable to stop talking. She thought about her old team lead, Santos, who was stationed at Pendleton and probably couldn't get leave. She thought about the silence of the cabin and the gate at the bottom of the access road that she hadn't opened for 14 months. "Not really," she said. "No." Adeline and Dr. Crow exchanged a brief professional glance. She had been in enough small rooms where people exchanged glances about her to recognize it, and usually it irritated her. This time she was too tired. "We can look into some options for the dog," Adeline said. "There's a vet clinic 2 miles from here, Dr. Halstead's practice. They sometimes board animals for patients in situations like this. I can make a call. He doesn't board." Maren heard herself say it and knew how it sounded. "I mean, he's never been kennelled. He doesn't do well with strangers." Kodiak had, in fact, once destroyed an entire crate and lacerated his own gums getting out of it during a training evaluation gone wrong. The evaluator had called him unplaceable. The evaluator had been wrong, but Maren understood why he'd said it. "Is there somewhere I could leave him?" she asked. Outside, a covered area, Adeline Marsh looked at Kodiak. Something in her face shifted, not quite recognition, more like attention sharpening around a specific point. "What's his name?" she asked. "Kodiak." Adeline was quiet for a moment. She looked at the dog with an expression Maren couldn't immediately read, and then she said, quietly, almost to herself, "Malinois, left jaw, working vest." It was the way she said it, not describing, not noting, knowing, the way someone named a thing they'd seen before. Kodiak's ears moved. He turned his head and looked at Adeline Marsh for the first time since they'd entered the room. Maren went still. "You know him?" she said. It wasn't a question. Adeline looked up from the dog. Her expression had changed in a way that was hard to name. Something had come into it, something careful and unguarded at the same time, the look of a person standing at the edge of a thing they hadn't planned to step into. "I don't know him," Adeline said, "but I know the program." She paused. "My husband was a K9 handler. Camp Pendleton, then 2 deployments to Helmand. He worked with a Malinois named Kodiak for the last 8 months of his second tour." She stopped. Her voice was steady. "My husband was Sergeant First Class Thomas Marsh." The room got very quiet. Maren heard her own breathing. She heard the monitor somewhere down the hall. She heard Kodiak take 1 step forward on the tile floor, his nails making a soft click, and then stopped. Thomas Marsh had been the handler who worked Kodiak before her. He had brought the dog up through training and through 2 deployments and through situations she knew about only from the handoff report she'd received when Kodiak was transferred to her unit. He had been killed in Helmand Province on a Thursday morning in March, 7 months before Maren's deployment, by an IED on a road that the intelligence reports had not flagged. The handoff report had included a single personal note from someone in his unit. He said Kodiak was the best partner he'd ever had. Take care of him. She had not known Thomas Marsh. She had only ever known what he'd left behind. "You're Abby," Maren said, and then caught herself. "Adeline, I'm sorry. He called you Adeline in Dock." She stopped. "The handoff report. He wrote your name," he said. He asked whoever got the dog to let him be a dog sometimes, not just work. Adeline Marsh was very still. "He said that to you?" It was a note. In the report. Maren looked down at her hands, then back up. "I've been trying. I don't know if I've been doing it right." Adeline looked at Kodiak. Kodiak looked at Adeline. He took another step forward, then another. He crossed the room slowly, without urgency, in the careful, measured way he moved when he had decided something was worth approaching, the way he moved at his own pace, on his own terms, and for no one's convenience but his own. He stopped in front of Adeline Marsh and stood very still. Adeline reached out one hand, low and open, palm up. She did not reach for him, she offered. Kodiak dropped his nose to her palm. He stood there for a long moment, his eyes closed, his nose moving slowly. And then something happened that Maren had never seen from him, not in 18 months of working together, not on good days or bad days or the long quiet days in the cabin when she'd thought she understood everything about him. He pressed the top of his head against Adeline's hand and held it there. Maren's throat closed. She had been holding something for 14 months that she hadn't had words for. It was the weight of inheriting a dog that had already loved someone completely and lost him, the weight of trying to be enough when you knew you were a replacement, the weight of the handoff report and the single personal note, and the question she had never let herself ask out, loud. Had she taken care of him the way Thomas Marsh would have wanted? Looking at Kodiak with his eyes closed and his head pressed against Adeline's palm, she thought, for the first time, that the answer might be yes. Adeline Marsh spent her break sitting in the chair beside Maren's bed, not talking, mostly. She had called her mother-in-law, who lived 12 minutes from the hospital, and the older woman had arrived within the half hour. A woman in her 60s, named Ruth, who had looked at Kodiak the moment she walked into the room and said, with the directness of someone who did not waste time, "He's beautiful." Tommy always said he was. She had taken Kodiak's lead without any drama, and Kodiak had gone with her with only a single backward look at Maren, which was the highest compliment he gave. After they left, the room felt different, quieter but not in a way that felt like absence, more like something had settled. "He really did leave a note?" Adeline asked. She was looking at the wall. "He did." About 5 lines. Most of it was standard handoff, behavioral notes, commands, triggers to avoid. But at the end he put that. About letting him be a dog sometimes. Maren paused. "I thought about it a lot. He was like that." "He always..." Adeline stopped. She smiled, briefly, the kind of smile that surfaces through grief rather than despite it. "He always thought the dogs understood more than anyone gave them credit for. He'd say, 'You can ask a dog to work all day, but you have to let him remember why he agreed to in the first place.'" Maren was quiet for a moment. "That's in the report too, almost word for word." Adeline looked at her. "He wrote it down, he wrote it down." They sat with that. "I thought about reaching out," Maren said, "after I got the report, after I found out what happened to him. I thought I should say something to someone, to you maybe, if I could find a way. But I didn't know if it would help or make it worse. And then I deployed, and then the program ended, and then I came home, and I was..." She stopped. She looked at the ceiling. "I wasn't really reachable for a while." Adeline nodded once. She didn't ask Maren to say more than she wanted to say. That quality again, the intake efficiency applied to something more personal. "I'll note this and move on. I'll give you space to decide what matters." "I'm glad you drove down the mountain," Adeline said. "I almost didn't. I know." She looked at Maren. "Believe me, I know exactly what that drive feels like when you've been living up somewhere high and closed for a long time." She paused. "I didn't come back to work until 8 months after Thomas. People kept saying I should take more time, and I kept saying I was fine, and neither of those things was quite true. What made you come back?" Adeline was quiet for a moment. "I came in one day to pick up some paperwork, and one of the nurses, someone I'd worked with for years, stopped me in the hall and said, 'Adeline, there is a man in Bay 4 who has not let anyone near him for 3 hours, and his dog won't let anyone near him either, and we cannot help him until someone figures out the dog, and you are the only person in this building who I think he might listen to.'" She paused. "She was right. I helped. And then I stayed. The dog let you near him. Eventually." Adeline smiled again, and this time it reached all the way. "They always do when you're patient." The surgical team came in at 4:30. Dr. Crow was with them, and he introduced a woman named Dr. Sylvia Park who would be handling Maren's case, a compact and precise person who explained the procedure with the same directness Maren had appreciated from Dr. Crow. No hedging, no false warmth, just information delivered with the respect of assuming she could handle it. She could handle it. She had always been able to handle information. It was the waiting that she was worse at, and the being still, and the lying in a hospital bed with the lights low while outside the windows the October sky went dark over the valley, and somewhere 12 minutes away a woman named Ruth was sitting with Kodiak in a house that smelled of someone Maren had never met, and Kodiak had never stopped missing. Adeline stopped in before the end of her shift. She had her jacket on and her bag over her shoulder, and she stood in the doorway for a moment, the way people stand when they have something to say and aren't sure of the approach. "Ruth texted," she said. "He ate. Half a cup of food, which she said is apparently an accomplishment." "It is," Maren said. "He's particular." She said he slept on Thomas's side of the couch. Adeline's voice stayed level. She said she didn't mind, looked at the window. The sea was fully dark now, and she could see her own reflection in the glass, pale, tired, in her arm, the mountain 40 minutes behind her. "I want to ask you something," she said, "and you can tell me to stop. Go ahead." Did knowing he had Kodiak, did that help? After. Adeline was quiet for a long moment. When she answered her carefully, the way she did everything. It helped to know that what Thomas loved was still here, still working, still taking care of someone. She met Maren's eyes. Did it help you? Having him? Maren thought about 14 months. About the cabin in the Cascades, and the gate at the bottom of the road, and the 2 a.m. nights, and the porch mornings, and Kodiak at the window watching the tree line. About the 14 months of believing she was keeping him, and the thought occurring to her now, for the first time, that he might have been keeping her just as much. "Yes," she said. "I think so. I think I just didn't know what kind of help it was." Adeline nodded. She moved to the chair beside the bed, not assuming, just offering, and Maren moved her hand slightly in a gesture that was not quite an invitation and was not quite the opposite either. Adeline sat down. "Get some sleep," she said. "Surgery's at 7. I'll check in before I go. You don't have to. I know." Adeline set her bag on the floor. She wasn't going anywhere yet. "You drove 40 minutes alone when you were in serious pain because you're the kind of person who waits until they absolutely have to ask for help. Thomas was exactly the same way." She looked at Maren evenly. "You can let someone sit with you. It won't compromise anything." Maren looked at her. She thought about the handoff report. She thought about 5 lines of text and a note about letting a dog be a dog sometimes, and about how a man she'd never met had still somehow managed to send her exactly what she needed. "Okay," she said. The monitor beeped steadily. The lights in the room were low. Outside the windows, clouds had moved across the valley, and somewhere behind them the Cascades stood in the dark, patient and enormous, the way they always were. Adeline Marsh stayed until visiting hours ended. Ruth sent one more text at 9:15. "He's asleep. Paw on my foot. Think he knows he's home." Maren read it twice. She set the phone down on the blanket beside her and looked at the ceiling and let herself, for the first time in 14 months, feel something other than the specific weight of a door she had locked and never opened. In the morning there would be surgery and recovery, and eventually the drive back up the mountain, slower this time, with the gate left open behind her. There would be conversations she hadn't planned for, and a grief she'd been carrying at arm's length, and a dog who had 2 homes now and knew the difference. But that was the morning. Tonight she rested.